Hi, I'm Dr. Carin Drummond, and in this episode, we're going to be talking about whiplash. So I was involved in a car accident in 2014, and I figured, being a chiropractor, I know how to handle whiplash. I wasn't sore at the time of impact, but I knew I would probably be sore by the following morning. No big deal. My husband's a great chiropractor. He'll take good care of me. In a couple weeks to a couple months, I'll be fine. Right after the accident, we were going out with friends to go to the comedy show, and everyone was like, "Why are you here? Why are you going to the comedy show? You should be at the office." And I was like, what's a few more hours? I won't be sore till morning anyway. But boy, when it hit me, I couldn't even turn to my husband to say, we need to get to the office like right now. By the time we got to the office, I was too tight for him to even be able to palpate my joint planes, which means he can't really adjust me. But we did palliative therapies like E-stim and ice, and I was in so much pain that I couldn't sit down or lay down, not even on the table, so he had to treat me standing up. But what was really shocking, and here I am an expert on whiplash, is that I personally, who I thought I was above the average patient because I'm in excellent shape, I get adjusted all the time, I do my yoga, I have good nutrition, I'm very, very healthy, so I should heal very quickly. But the damage was so shockingly severe, even though I looked undamaged. It took me almost a year to get to the point where I can work on re-strengthening myself, and it took me another year to get all my strength back. Most pain when you're injured has two nerves that transmit the information of pain. You have your distal nerves, and then there's another nerve that goes from your spinal cord to your brain. So there's synapses between these nerves that can be altered by, generally you can get ibuprofen or Aleve. They can block the pain that way, or you could rub it, and the sensation of rubbing works because the pressure nerves closed off the gates of pain, so you don't feel the pain as readily. Or there's TENS machines that use little electrical currents that kind of disrupt that pain being transmitted. But with whiplash, the injury is at the spinal cord level. So that nerve that goes from that deep part in your spine goes straight to your brain. There's no turning off that pain. Nothing was touching that pain. And I was not about, if I took narcotics, that would have numbed the pain, I'm sure, but I wasn't willing to go to that extreme. So I had to think of other things to get well. And then all the advice I was getting from my medical doctor friends was shocking. And I got an MRI that revealed 4 disc herniations in my neck, and an orthopedic friend of mine and a radiologist friend of mine both were saying things like, "Oh my gosh, you shouldn't get adjusted by a chiropractor and you should get surgery." If you get a disc herniation that's so bad that it's literally killing your nerve, you don't have the time it takes to get well. You don't have a year or a couple months. You have days. So of course surgery can get the pressure off the nerve right away, and you can save that nerve. But now you have some damage to your neck that limits your potential to full recovery. Being a chiropractor, which is a very physical job, I couldn't afford to have a neck surgery. And admittedly, it took a lot of different treatment modalities to get to where I am today. And I was wanting to share this knowledge somehow, because there's so many people out there that are getting in car accidents, and they are getting, in my opinion, very poor advice on how to get well. I've had people come to me months after their car accident, and I was like, "Why did you wait so long to come see me?" And they were told not to see a chiropractor, which is shocking to me. And I've had other people that just took pain pills for years, and their bones literally became more malformed from improper movement. Another thing I wanted to share with people is bones are living tissue. They aren't pieces of iron that rust with time. If you see degenerative changes, it's not because everyone degenerates over time. It's because the living bone tissue is remodeling against the aberrant stressors that's put on it. Like 7 years prior, they had seen a chiropractor or gotten physical therapy to increase the range of motion in their neck or anywhere in their spine. The bones wouldn't have thickened like that over time. I've had people that had grade 4 spinal degeneration, and over 7 years, it went from grade 4 to grade 1 because they completely changed their lifestyle. They followed the triangle of wellness. And I want to get that information out there so other people can learn to truly be well. So there's limitations to the body, yes. There are some genetic vulnerabilities people have, but it doesn't necessarily mean it has to express fully. The healthier you live, the healthier your body is going to be. And some amazing things have happened when people start living well. They got better in ways they didn't think was possible. A lot of people think whiplash is caused when you're stopped and your head whips back and forth with that impact, when actually the injury from whiplash first starts with a shear force. So the head is staying, the body is shoved forward, and you get this shearing force in between the bones of your spine. And if it's coming from behind, it's typically the lordotic curvatures, and so like your neck, for example, and that tears little fibers that kind of hold your disc, and there's little ligaments that hold your bones in place. So now that structure that holds things so that when you do whip it, things don't go out of place, well, now they're damaged, and then your head whips back and forth. And then they move very grossly and aberrantly, and that's when the damage occurs. But one thing I wanted to dispel, I wrote a book called Whiplash More Than Just Neck Pain. It's just a little booklet to give people an idea. When you're in a car crash, you are gripping the steering wheel, which can cause injury to your hands or your shoulder with the shear force of that impact, or you're braking the brake pedal so hard that you collapse the arches of your foot, or you hurt your knee or your hip. It's so much more than just a neck issue. And I've had people come in saying, oh yeah, I have whiplash, my neck really hurts. And they don't even say, since the car accident, I've had foot pain, I've had hip pain, because their neck hurts so bad, they don't even think about it. And then months later, they bring it up, and the insurance companies will be like, well, that was months after the accident. Yeah, but it was there the whole time. Well, why didn't you talk about it? Because my neck hurts so bad. So a good practitioner who deals with whiplash patients needs to ask all the questions. Yes, your neck hurts, let's examine that. Let's examine your shoulders, your wrists, your knees, your hips. I mean, all these things could be affected by that car accident. Documentation is key, and doing objective measurements. You don't want to say, oh yeah, they were kind of restricted in their range of motion. You want to have the degrees of limitation, and you want to see with each treatment you are getting better. Because if you're not getting better, that treatment isn't working for you, and you need to find a treatment that is. The one thing to keep in mind, if you've been involved in a car crash, if you're sore the next day or two and you're feeling better from that soreness, and it's been a couple months in and you're feeling a lot better now and you're just wanting to settle because you want to close the case, take pause. Because I've had patients that after a couple months they settled their case, and then 6 months down the road they started having the knee pain and the hip pain. And what was happening is, because their arch collapsed in their foot, every time they walked it was starting to like irritate other structures like the knees, the hips. But it takes a couple months of walking on a malfunctioning foot before it finally expresses as pain somewhere else. You have 2 years to settle your case, and if at all possible, I would wait that time to make sure nothing rears its ugly head. Some people do great with chiropractic manipulation, some people do great with massage, physical therapy, acupuncture. I did a plethora of treatments because I had 4 disc herniations, and I wanted to make sure I didn't end up with having to have surgery. And then I write all of the treatments that I did on a day-to-day basis in my book, Whiplash to Wellness, A Chiropractor's Journey. So if you're interested in any of the treatments I did, they're all in there.